Welcome to Move, Elevate, Thrive, a podcast sponsored by the Pilates Center of Austin.
We're here to unveil the superpower you didn't know you have. Welcome to episode 4 of the Move, Elevate, Thrive podcast. I'm Jacob Apodaca, and this is
Marcos Apodaca.
So today we just want to hopefully get you guys into myofascial release, get you excited about it, talk about our experiences helping people practicing this, learning so much every day, every session. We're going to talk about our stories. First, we're going to go to Marcos and talk about his experience. He's had a lot more experience than me working with the human body and Pilates and a lot of wisdom to share.
So we want to take it back to how I got into MFR, and I want to tell you about one of my clients who really kind of opened the door for me a bit. So I've been teaching Pilates for 20-something years, and one of my clients, she started doing massage work and got into MFR because she knows a local practitioner. And so I was curious because, one, I've always studied myofascial or fascia through Wendy LeBlanc Arbuckle. And I might have mentioned this in the first podcast. But just to say a little more, Wendy has always taught whole body health, right, embodied movement. We talk about, caring for, our environment, but also caring for what's happening within. And that goes to our movement practices, Pilates, yoga, I like to play soccer, doing lifting weights, whatever that is, take an approach where you can be in process and not just look for the results. Because what we find when you really dive into process and have that help you what gets to the result, you get deeper, you just get further, you get so much more out of that. Mm-hmm. And so Wendy was a big component for me to get into the fascia, understand it, teach people from a whole body perspective. Right. And so then with working with people for 20-something years, I've been here at this studio since 2004. And so working with Linda, who now helped me see myofascial release work with John Barnes, okay, I got to go do a seminar. Yeah. So she had the seminar. It was called the Fascial Pelvis, and it was amazing. It just showed us so many different ways to work with the tissue. I've always loved being with people on the equipment, and maybe if I see them doing, say, something called footwork on the reformer, I'd put my hands on their hips or thighs just to help them release some tension. As you know, and I'm sure y'all listeners know too, your quads and the calves and their hips usually hold a lot of tension. Right. They say sitting is the new smoking because we do too much sitting. And so the hips hold a lot of tension. So just a little pressure helps release tissue. Well, going into myofascial release work at this fascial pelvis seminar, it just gave me a new sense of understanding touch. Yeah. And the power that is in just simple touch, light pressure, and then listening for the response from the person you're working with. Exactly. Just saying that just kind of sounds phenomenal because now you're working in relationship with the person instead of me just forcing tissue. And that's been huge for me. And the way that I love to see people change is when they really take it on. I love my clients; they're all amazing. But I always have some that are just I just want to come and just do my workout, and then I just go about my daily work, which is fine. Nothing wrong with it. People want to do that. But the people who really dive in and do the work, right, to really listen, pay attention, they see results. Yeah. That's results in movement, in practice. And so kept going into the mouth. I did fascial pelvis. Then I did myofascial release 1 and myofascial release 2. In between, there's something called unwinding. And I'll say a little bit about that for our listeners. So sometimes when you go into myofascial release, if you're going in slow enough and the person can really go deep into what's happening within the release, things will start happening. Not just on a tissue and muscle level, but sometimes on an emotional level, sometimes on, bringing back memories of what happened in the past. Yeah,
post-traumatic,
surgeries. We've had people say, "Oh yeah, this is something that happened lifetimes ago.
Yeah.
You know, like, and I don't know how true that is or not, but I just think, hey, I mean, they're living their experience. And so what was really profound for me was to see people unwind at this seminar. We did it for like 3 days, and you would hear things like just people like yelling, just screaming because they're letting go of things that have just been in their bodies forever. My experience was one time we did this unwinding, and we had like 3 or 4 people with me, and they were supporting me on the table. Eventually, I came off the table because I just started like moving in a way that my arms were kind of flailing, my legs started going up in the air, and the responsibility of the people who were with you was just to support me. And I literally did a backflip,
Yeah.
and they helped me complete it safely. It was like, and I felt amazing afterwards. Like it's like my body was holding a deep tension, and it wanted to go the other way.
Yeah.
I just never really gave it permission to do that.
Yeah.
Because it didn't feel safe.
Yeah. And it's one thing, real quick, and just like he was saying with unwinding, he was talking about the people's responsibilities to assist you if you feel like the need to move. What they were told us is to make it like the person that's receiving the therapy, that there's no gravity involved in the situation. That way they can freely move their body wherever they need to go to relive a past trauma.
Yeah, and it felt exactly like that.
Yeah,
like gravity-less.
Awesome. Yeah,
and I felt so free, just so open, so relaxed. I mean, it was just amazing. From there, went on to do something called the cranium and thoracic, which goes deep into like what's going on within the head as far as like head injuries or even like people braces. John's contention is that people don't need braces because we're doing a lot of narrowing just with our mouths with tension, but really we want to open palate.
Yeah.
And so MFR, we learn in cranium, we learn how to open the palate with the teeth, even nostril. So that was amazing. Then thoracic was amazing too, because thoracic, the mid body, from the neck down to the mid body is so tight for people. And so we learned some things, how to release the back tension, open up rotation. Amazing. And then once we did MFR and 2, the cranium and thoracic, that's when I met with Jacob. I think it was I want to say it was December, January.
I think so. I think it was December.
It was December.
Yeah.
Because that was I was going to go with it. Right. And so you can tell the story more later, but for me, the short story was I knew you wanted something different. Yeah. And I knew you were ready to make a transition from being a firefighter for, 5 years, working hard as you did, and how much sacrifice you did for your family to do that work. And it was like, hey, I'm going to go to massage school. I told him, and I'm going to open an MFR practice there. I'd love to have you join me. What do you think? And what'd you say?
Well, no, like honestly, like at first, I kind of took it as a cop out, honestly, just to get out of my job because that's how much I hated it. And I was kind of worried about that because I wanted to truly love, like, the next venture I went into. But then after we went to that first seminar, my dad and I, he redid MFR 1 and 2 with me, and I did it for the first time. But it just completely opened my eyes. Every seminar, I was just there. He can attest to that, just like soaking in every word. The movements obviously weren't, like I wasn't doing the best, but like I learned so much in those 10 days. I think we were there. And just like being in Sedona, there is something about that place that's just so nice and refreshing, going on the hike, seeing the beautiful nature, all that amazing stuff. But anyway, it really just brought about a lot of mental healing and peace for me that I obviously wasn't getting from my other job, which is pretty stressful, 24/7. So no, it was just an eye-opening experience, and I'll be forever grateful that like he, told me about it, because otherwise I never would have known about it. So, but yeah, no, I'm really loving it. Every session, every time I get to practice with somebody, it's amazing.
Yeah, and so when Jacob went, when he came, Hope came, his wife, and I took my son Joshua too, and we had this amazing, like you said, week and a half there in Sedona, and even like you said, I'm already full tilt inside, right, loving the work. But then I got to practice with my son, not just Jacob and Joshua and Hope, and you just see these transformations. And at one point, I knew how stressful you had been from working the 5 years and how much trauma that was to see all you saw. And so we did a release, and we've talked about this before, but I want to say it again. We did a diaphragm release, and that, like, he went into an unwinding there where his body started to like shake and move in ways that he was, again, he's fully conscious, by the way. Like an unwinding, you're fully conscious, so you can stop it at any moment. So don't, if you ever want to try MFR, know that you're always going to be in control, whether the person's working with you or on you or having unwinding. You can always stop the situation because you want to feel safe. The whole point is to feel safe.
Yep.
And once you feel safe, things happen. And so he began to unwind in a way that you could just see trauma just leaving his body. And well, the breath thing was huge.
Yeah. Yeah, so to get into that, so like after just the eye-opening experience of just being at the seminars, getting to practice the moves, and then we would go back to the Airbnb and he'd practice on me. Like you said, he did this diaphragm release. And I didn't, like, I knew my breath was bad just from, years of tension and not taking care of myself as I should have. But once that happened, like, I felt like I could breathe throughout my whole body. Whereas before it was just up to like the bottom of my ribs. So that was insane. Like I felt like every cell in my body had enough oxygen that it needed.
That's amazing. Actually, I would love to do a podcast about that, like just talk about breath. But once you can see it because once your ribs shifted, your whole spine shifted. You could see your posture shift. I mean, you just freed up.
Right.
And so that's the beauty of this work, and that's why we want to share some of these experiences that we're having with some of our clients today and all that. But yeah, I'm bull-tailed.
Yeah.
What about you? What? So I know you just mentioned. I that might be a question for some of our listeners. So you said at first it was kind of a cop-out. Now you're like really loving it, and you've been practicing now for about 6 months. Where are you right now? Where's your thoughts?
Well, so what I love about this work is that it gets the patient or the client with more in tune with themselves, as he was saying earlier. And in EMS, sadly, it's not like that. You run into people that are on 20 different prescribed medications from their doctor that is all there to treat the symptoms that the patient went to their doctor with. And they're just treating that symptom. But where did it come from? How did it start? How did we get here? What about that? What about treating that primary problem first instead of just, okay, let's put you on a statin and lower your cholesterol? And, just so many different things where your body's just like not having to work as hard because it's relying on the medications. Our body's amazing, but once it takes too much of something, it becomes reliant on it because then it accepts it as its new reality.
Right.
And that's why I love MFR because, like he said, the client is so important that when you don't fall asleep, it's not a massage, and the client is very in tune with themselves.
Right.
Which can take some sessions to get to. It took me a few to get to there. I feel like I'm still not truly there, but it takes a while. But it's so important because it helps you realize where I'm hurting, where I'm actually hurting, and not my knee telling me, well, it's probably my right shoulder or vice versa. You know what I mean? So it all is a compensation pattern that the body, the pain is there to tell you that something's wrong, but it's not going to exactly pinpoint it for you. And that's up to you to take care of yourself and the therapist to help find that. And that's why we listen to the body. Yeah.
I think, let me go back to Sedona one more time because I know I said this before. When we were at Sedona, I had an incident where I went to some really horrible pain. So I'll make it brief, but what John calls that when you're in a place where you can't. Now I was in a place where I was in horrible pain. I thought I was sick. Okay, so this may not be the day-to-day uncomfortableness that we go through, but it was definitely specific. But I'm going to use it as a way to illustrate what John talks about. He talks about a straitjacket. Okay, so when fascia gets stuck in a certain way in your body, whether it be surgery or an injury, sometimes just bad posture, sometimes just life in general, the tissue begins to pull in a way, and we actually have a video of this that we'd be glad to share in the show notes. But it'll pull in a way that the whole body will fall into that restriction. And what happened was I was sitting on the couch doing some work on a day off that we had during that seminar series, and my left side of my abdominal wall just started hurting. Started slowly at first. I felt horrible, really nauseous, didn't want to eat, didn't know what it was. Tried to give it a day or two, nothing changed, and we thought, you know what, let's just go check it out. Yeah. So we went to the hospital there in Sedona. They talk about healthcare. I mean, they were the sweetest person. I'll say that. I don't want to say something that's not true. The nurses and the doctors were absolutely the sweetest. Right. They meant their best. Unfortunately, their best is just not good enough. And I'm sorry to say that. It's just true. They checked me. and the doctor only touched me one time, and barely too. She said the pain's right here. Touched it. Oh, well, we did that, and they rely on their machines. They rely on they did a CT,
Right.
wanted to make sure that with contrast. There was nothing there, but she was like, I don't see anything. I don't know what's wrong with you. Gave me the pain meds, sent me home. They gave me antibiotic actually, right?
Yeah.
Which I did take. I don't remember if I took. I don't think I did. No, that was for previous. It was
that
previous one.
Yeah,
Yeah.
yeah.
I was actually sick before I left, but it's then different issue. But anyway, so the next 2 days, I started feeling a little better. Went to the first day of the next seminar that we're going to do, which is MFR2. I had a session that night, Thursday night, with one of the practitioners there at Therapy on the Rocks in Sedona, and she spent about an hour and a half working with me. Opened up my left side, released my psoas on that side, and I went home feeling really great. The next day, I tell you, I was like boundless and leaping and ready to go climb Mount Everest. I mean, Jake can testify too.
Yeah, like literally, he went from like not being able to move without pain, not being able to eat, not being able to sleep very well. Then very next day after that therapy session, we went hiking, and he climbed all the way up. But what's that?
It was.
I can't remember.
It'll come to me in a minute.
But yeah, we went out in Sedona and all that beautiful nature out there. And he climbed like all the way as high as he could, and like you would not have thought he could do that like the 12 hours before. So pretty amazing.
I was just unlocked, like
Yeah.
literally unlocked,
Yeah.
and that was the straight. Like it was again, that was an extreme circumstance because I had what I did to my body sitting down on this couch on a computer, like the typical thing that people do all the time,
Right.
and it just locked me up. And I got released, and I was ready to go. But some of you may not have that extreme, but you'll have something similar. John Barnes calls it micro traumas. So that was a big one because I felt it. I knew was where the pain was. Micro trauma is like, okay, say you are just sitting and you feel good. You're sitting up tall in your chair and you're still hacking away at your computer. You're still going to feel micro traumas because guess what? Your elbows haven't moved for about 8 hours, or maybe your wrists have been in the same place for 6 hours.
And then your metacarpals, and then that leads to arthritis and all that.
It all goes into the same system, so it's like getting locked in one way or another. And so being released from that situation just opened my eyes to the possibility of this work.
Right.
And now going into the people that we've been seeing, I've been seeing for the last 6 months, I'm seeing tremendous results. So can we get into that part? I'd love to share some things.
Yeah, for sure. Just real quick to talk about like their modern healthcare. So like we're taught, I mean, I was taught, doctors are taught, I'm not taught as much as a doctor, obviously, but we're taught to look at the one organ that's affected, the one tissue, part of the tissue, one part of the blood vessel, whatever. We're taught to look at just that. And we're also taught like what it could possibly cause that, but we never ever dive deep into that. Even though we're taught that, we're taught how the heart circulates blood. We're taught how it's a whole system. Your heart is literally just a pump, and as long as there's enough blood and oxygen there, it's going to be fine. So, but they never thought about how literally we're compacted. Your intestines stretch almost 27 feet once they're fully laid out. I'm not 27 feet tall. He's not 27 feet tall, but that's what shows you how compacted it is. So if you have a restriction in your abdomen, something's probably going to happen because it can't properly process food, process bile, process blood, process oxygen, CO2, everything it needs to do. And then eventually, when it goes untreated, you feel a little better, take some antibiotics, feel fine for a few weeks, and then something else happens. And it's probably just a result of the first thing that happened. Because again, like he was saying, that once a restriction happens in one area, like if this is a mesh shirt and I'm being pulled this way, I'm already compensating over here. There's stretching and tightness happening over here. So they're going to be like, oh, I have pain in my right shoulder, but guess what? It started here first. And that's why it's so important that you assess the patient. As he said, the doctor only touched him once. How can you assess that? Like he said, they go off their machines. Machine's not a human. Just that simple touch, you can already feel tension. You can feel what the body is trying to tell you. The body will talk to you. We're all created equal, and so therefore we can communicate with each other. So
So let me talk about a couple of clients that I'm seeing. One of them most recently had this amazing transformation. Now he's in the process of it, but I want to just say he's going through it and it's amazing. And honestly, I'm feel very privileged to learn from this. and be with him in it. So he recently had a cancer, and they were able to take it out in part of his tongue, but and no chemo, no radiation, but they're still having to watch that, of course, and so the doctor is probably gonna. He's saying he's probably going there and do another second surgery just to help his tongue learn how to move again, because right now it's very restricted. Like he couldn't even stick out his tongue. And so we did something called a tongue pull, where he just lays there, sticks his tongue. I'm wearing gloves, of course. I used a pillowcase, something that just could grab it, and I was gently pulling on the tongue, and just enough to feel restriction. I didn't want to. I'm not trying to cause more. I'm just trying to go with what his body will allow. Held it for like maybe 3 minutes. After about 4 minutes, it just came out a little more, and by itself. I kept the same tension, but then the tongue began to release. And so at first, when I said, okay, stick your tongue out before, it barely come out on his lips. After we're done, again, that was about 7 minutes that I held it. Then he could go past his lips. And speaking to him afterwards, a couple days later, he's like, yeah, my stomach felt freer, actually. His stomach felt freer. And we know the tongue goes all the way down to the pelvic floor, and is part of the nervous system there. So once he got that release, his tongue is still able to move more. His stomach felt less like tense and more relaxed, which is a big thing for people.
Yeah.
It was phenomenal, and he's like in awe of it. Like he's all in.
Yeah.
That was amazing.
Yeah, because we don't even think about like how like our tongue, it's gonna get tight. Think
Yeah.
about that. Like if you like stick out your tongue for too long, or if you're like, it's gonna get tight, or it's gonna feel like it hurts for some reason. If you overuse your tongue in some way, it's gonna hurt, and that tells you, okay, well that part of the body needs to be worked.
Yeah.
And it can seem taboo, but it's not. It's just working on the body.
Just working on the body. And the lady that I referenced earlier, she showed me a picture of the tongue that's been doing MFR for a long time. She showed me the tongue actually attaches way down in the throat. I mean, it's big,
Yeah.
way bigger than I think it is. Because I was thought like, oh yeah, it's in the tongue, goes to the back of the mouth. No, it actually goes. It gets bigger and it goes way down into the. I mean, it's ginormous. So yes, it's going to have an effect to your neck, to your jaw, maybe even to your hearing.
Wow.
Like some people have tinnitus, you can do a tongue bowl to help release that tension.
Wow.
I mean, it's just phenomenal.
Yeah.
Let me say one more. I want to hear what yours too. One that I have, she has a scoliosis with a hump on her right side. It was really profound. I mean, see her walk by, you could actually see, well, what's that? Oh, it's just scoliosis. All it is. So she's been doing Pilates, and we have something called a yoga wall. It's a lot of inversion and hanging for a long time, and that really helped her. It helped her decompress.
Right.
She does taxes and is a CPA, so she does a lot of computer work, so it can get dense. So she loves hanging upside down. So for years we've done that. Now that we've introduced myofascial release work, the hanging is so different because like her ribs are starting to separate now on the side where she has the hump.
Wow.
So in scoliosis, when you have a structural scoliosis, it's something you're born with. It's something that comes. It's like your body is being pulled. And in her case, her right shoulder was being pulled, her right upper back being pulled to her right, her left side collapsing, her hips had to counter by twisting the other direction. And she's like, you ask her, she says she's fine because she's dealt with it for years. Of course, she's fine. But now, you know what? I'll just jump to the exciting thing. She's now realizing she didn't realize how tense she was.
Yeah.
She's now more relaxed overall.
Yeah.
Because now we're releasing that tension that was just so held. Again, there's a straitjacket. So releasing the rib cage, releasing her pelvis. We're doing a lot of stuff for her cranium because she had a head injury, and that's like moving things, and she's feeling so much better. So those are two people that I'm just so thankful that I have the opportunity to work with.
And just like you was saying, like the body will do anything it can to make you as comfortable as you can in whatever situation you find yourself in. Even if you're sick, it doesn't feel like the body's making you comfortable. If it didn't do anything, you'd feel a lot worse and probably die. And so like he was saying with scoliosis, like her body had to compensate for how her spine was structured.
Right.
And because she's dealt with it for years, like we don't realize, because again, the body's there to always be in a state of homeostasis. It's always trying to do that. And So it'll compensate forever and ever and ever, and you'll get used to it and used to it and used to it. And then once you go through this myofascial work, you're like, holy crap, I didn't even know. I didn't even know that like I felt
Mm-hmm.
this way. Just like me when he released the diaphragm, I didn't realize like I wasn't. I knew, like I said, I knew it was a little restricted, but I didn't know it was that restricted. So it's truly amazing, and that's why it's so important to constantly assess yourself every day
Mm-hmm.
and see where you're at. But as far as with me, like obviously I haven't had as much experience working with people as he has. You know, it's been over 25 years. My only experience is like in EMS, where you know, more like the life-threatening side of stuff. You know,
Yeah.
but even then, not even life-threatening. They had a lot of silly calls, but anyway, once I got into this work and got to practice it more and more, I started practicing on my wife, obviously, and she's had a lot of like allergy issues. She had to deal with mold for a long, long time, and it severely messed her up. So it affected her sinuses, affected everything in her cranium. Always having head pressure, always having headaches, and like we're always taught to like, oh, just take this pill, take a painkiller. Some people take like a ridiculous amount of painkillers just to get rid of a headache, and it's like, no, there should be something that can release
Yeah.
attention. And we think, oh, well, it's just your skull. How are you going to release your skull? It's bone. No, the fascia goes through your cranium into your brain, into and controls everything there. And that's can even be how depression can be caused. And
Mm.
it can start as early. The trauma can happen as early as just coming through the birth canal and having the skull compressed when it's not fully formed yet. It's very malleable as infants, and then it'll grow in that spot, and they can lead to depression, anxiety, suicidal ideations, alcoholism, ADHD, ADD, autism, so many different things, epilepsy. We could go on and on about all the neurological problems.
Yeah.
But after a time, you know, like we said before, it took some time for her to really feel it and really feel that release for herself. Because when we're talking about feeling the release, we're talking about truly shutting out the world around you and
Yeah.
being with yourself
Mm-hmm.
and feeling where the therapist is working on.
That's hard.
Otherwise, and it's hard for a lot of
Mm-hmm.
people, for me too, because like who wants to truly let go? That's scary.
Mm-hmm.
That's a scary thing for a lot of people. But it's a
Mm-hmm.
mental game. It's a mental game, and that's why it's so important to be in that space. Anyway, just as we're continuing to work on her, like one day she's like, "Whoa, I finally feel like I feel my tissue moving." Because like obviously I was able to help her a little bit, but not truly fully release everything.
Mm-hmm.
But just this one day, it clicks, and then all of a sudden the movement so much more. Even just the first time putting the hands on her, immediate response from the fascia. And what I mean by that is you'll literally feel like a rumbling
Mm-hmm.
underneath the skin.
Right.
It's awake, it's alive. Our bodies are alive. We don't have to plug in every night. That our plug in is to sleep. But we don't. We're self
Healing,
self-healing.
self-circulating.
Yeah, self-circulating. We're
Mm-hmm.
not just need to be plugged in every night. So anyway, that was interesting, and I've just practiced on family members. I've been able to help him a little bit
Mm-hmm.
because obviously, like, we're not saying one session fixes all. Like, I was still able to help him after his incident in Sedona and help just continue to release the
Mm-hmm.
abdominal wall, the psoas.
Mm-hmm.
I think we've done some pelvis work and stuff like that.
Yep.
But just like learning more and more, and just still getting a touch for it for sure, because I'm still very new. But I've gotten to practice on a lot of people who've had a lot of injuries as well, and that's interesting because it's when people have screws put in or rods put in or even surgery done, it greatly affects how the body heals. Because the body's instantly going to start healing, like we talked about in the last podcast. The osteoblasts will start forming, hopefully, and then create new bone or whatever the body needs.
Right.
But obviously, it's not going to just form perfectly.
Mm-hmm.
We have to help guide that. And sadly, with surgery, it's needed, but how are they going to follow that one person's specific structure?
Right.
There's 8 billion or plus people in the world. That's 8 billion different structures to their body, relatively the same, but still
very different.
Very different.
Absolutely. Yeah.
So
yeah.
I mean, that's really all I have to say with that.
No, I mean, I love to hear about how you're growing into it. So Jake's been coming to the house often, and so we have a massage table there too. So you've been working with like the kids there, Joshua and Rebecca and Abby, and even I think you did Elijah one time.
Yeah.
But so like I love to see your desire to keep learning more about it, because even though I've been doing this for 20 years, I don't know really I don't want to say JS, but I mean, I only know as much as I've been taught so far, but it's really in the experience. Like,
Yeah.
it's in the experience of the touch, the feedback from the client, the environment that you create with the client.
Right.
One thing that is so important that you just said is it is a mind game. How do you create that atmosphere to someone to come in to be with you on the table,
Yeah.
to feel safe enough to let go?
Mm-hmm.
So right now we're both doing our clinicals and finishing our massage work. And one thing that we're as working with people is they come to us and which is great, love it. But there's always the setup is they're coming to learn to do something where they're helping us get our hours and they're benefiting from getting massage or do some MFR work, which is great. But I always look at the mindset of how it sets up the the session to go. How you step into any situation, whether you go see someone who has 30 years experience or someone who has a year experience of doing MFR work, you're going to walk into that place a little different.
Yeah.
Because your mind, okay, I feel safe. This person has all the experience to know how to handle what I have.
Right.
This person is still learning, so I'm just gonna be a little guarded, and sometimes on a subconscious level. Again, this is all fine. Like, I'm not no judgment here. It's just interesting to like look at.
Yep.
So how you and I go into those processes with people is we keep talking through them. We use our voice. We use breath. We have them play with breath work while they're on the table. Like, this experience, I'm telling you, has just amplified my love for movement and Pilates, because it just amplifies that. But two, my love for to see how people can move and be the individuals that they are, and like we say, everybody's amazing at the Pilates Center of Austin. It just amazes me.
Yeah.
So yeah, we just like Jacob is saying, I highly encourage everyone who's listening to this, take the time to listen to where your body is. Even right now, just close your eyes and listen. Just pause, take a pause right now. Just listen. There's so much happening in your body where you can pay attention and just be aware of your body saying, "Hey, pay attention to me right here on your foot," or "Hey, go take a nap." But listen. And in this environment where there's so much happening right now, especially recently had this recent tragedy in Kirk County, like, there's stress, a lot of stress. Yep. And I see, and a lot of my clients, they knew a lot of these people who lost so many of their children and people, and it's horrible. But all that is just stress, and we try, and while we want to be with people on that, which we need to be, absolutely support your fellow neighbor, you also want to recognize, you want to learn how to step back, take a breath, listen to yourself as well. One of the tenets we hold to is to love somebody else means to love yourself just as much. Take care of yourself so you can be fully there for that person.
Exactly. Yeah, and that's why it's important, like he's saying, to fully, like, even right now, just like let yourself, if you're sitting down, just completely drop down to the ground until your hands are touching the floor, breathing deeply the whole time, closing your eyes, turn off the lights in the room. And then once you're done with that, go all the way to the one side, let your head drop all the way. It's the same thing on the other side, and just really feel, like, just feel yourself, feel your body, feel where something might hurt, might not hurt, whatever. But it's really good to get into that mindset of what we're talking about, because otherwise, if, like he was saying, we have people coming to our school to do our clinicals so we can finally practice professionally, and yeah, they're going to be guarded because, like, they know we're still under learning, or especially me, I'm still under learning, or learning as much as I can, but it's not a professional setting. And that's why it's so important to have good bedside manner, like you're saying, talk to them the whole time, and just really present a really healthy, happy environment. Because you hear about people saying, when I go to the doctor's office, my blood pressure is always 150 over this.
Right.
We don't want that. We want them to be calm, resting heart rate, just relaxed and not stressed. Because yes, like he's saying, like what he was saying about all the other stuff happening in the world, people that have been affected, you have to shut it out and just be within yourself, within the room, and feel it. And it's so important. And we're not like the doctors,
Yeah.
We don't want people being scared. Then that kind of ruins the whole purpose.
Yeah.
Because then you can't even assess yourself. You don't even know what's wrong with you.
Yeah. I just had an idea. One thing that, we look at ways we can, as we take care of ourselves, then you go out and see how you can help the community. Like, there's ways that we can, go out and help the community and do that. So we look for in the future for us. We may offer some kind of MFR day where you just come to us for 20 minutes. Give us 5 minutes.
Yeah.
And you would be amazed at what kind of change you can experience. So we'll put that out soon in a day where we're ready to offer that, and we can do that here at the studio. But we want to have people really know and understand this work and the transformative power that's there, because it's pretty amazing.
Yeah.
Yeah.
Because what I've seen, like what's always been my biggest gripe is just people being content with where they are, even though it sucks, even though like it's something they could change, but because they're told like, oh, that's just how life is, they're fine with it, and then they like, oh, I'll just go to my doc and see what meds he puts me on next. But I hate that. It's not about that. There should be a way for us to heal ourselves. If our body instantly starts the healing process, even when you just get a paper cut or like stub your toe, or then we can surely assist in that healing. And
Right.
this myofascial therapy shows us that we can.
Yeah.
And
Well, I'll say one more thing about that. A lot of times, I can see people get hung up because of like, oh, I can't afford to do that. I don't have time to do that. That's for somebody else. That's just not me. The when I would ask you to keep your mind open to the possibility that you can, one, like you said, do this yourself, which is very, very possible, or two, even if you can afford to go out and spend time with coffee for a 1 month, you can afford at least one session
yeah,
of MFR. One session, and you because of the what we learned and how we went through the process of like being with people, we can absolutely transform you. But or look for someone in your own location. Look up MFR specialists in your location. And there's
specifically by John Barnes.
well, yeah, I would say
Yeah,
specifically John
taught
Barnes,
under John Barnes.
and they will completely be able to help you. But as you learn, just like Jacob said, just doing small movements at home, do things outside the norm, stretch in ways that your body first would say no to, but maybe just play with it a little bit. You don't have to go like full extension, back bend, like exorcist or anything. You just have to give yourself time to like feel something outside your normal range of motion.
Exactly.
And the body will like, thank you, actually.
Yeah. Like think
Yeah.
about it. Your head should be able to completely drop
Right.
to the on your shoulder, and same with the other side. And we can actually turn a lot more than we think we can, but we're just restricted. And like you was saying, even if you can't afford it, I'm sure you have goals. You have personal goals. You have bills to pay. You got daily life to do every day. How are you going to do that if you're broken? How are you going to do that if you are restricted in an area? Your body is your temple, and it is something you need to protect and take care of constantly.
Yeah.
Because we're not perfect, so we have to, strive for that, perfectness that we won't get to, but we can get to a happier, healthier state.
Yeah, that's why I love our podcast names. I'm just gonna say it because it's so self-love. Move, elevate, thrive. Right? You move, you elevate by that movement will move. What I love about movement is it only goes up. Like it's sometimes people say, oh, sometimes I'm stagnant or I hit a plateau. Even in that, your body is still developing itself.
Yeah.
Never stops. It's just in our mind we put that block there. But if you're moving, you're going to be elevating yourself. You're elevating yourself, you're going to thrive because you're only going to have your best foot forward.
Exactly. Movement is medicine. Being stagnant is not. Like if you have a desk job, that's not your fault, but like make sure you have some movement afterwards. Make sure you stretch. Do all that important stuff. It's medicine because it's allowing your body to circulate more blood, more oxygen, which is what your body desperately needs constantly 24/7.
And we always see it with our kids. Like I have, Jake is my oldest. I have 9 kids. My youngest is 4, and watching her, she's always bounding, leaping. Actually, so is my 10-year-old. But still, they're bounding, leaping. She's flying. She wants to be flown. I mean, she's just always moving.
Yeah.
And of course, she's young and healthy, but still, like, what an example.
Yeah, and just to speak more to that, when we're talking about Channel 3 and Channel 5, Channel 3 is when hopefully what you can get into in an MFR therapy session where you shut everything out, you're with yourself, with the therapist. And then Channel 5 is what we're mostly in all the time. We're worried about ourselves. Like right now, I'm not worried about myself. We're worried about this podcast. We're trying to share as much information as we can. I'm thinking about that. I'm not thinking about myself, right? He's not thinking about himself. But that's why it's so important to get there. And then when you look at children, like he was just saying, they have so much energy because they can feel all their energy so much more than we can because they haven't had enough time to shove everything down like we do with our emotions, with our thoughts, with our energy.
Mm-hmm.
They want to get it out. That's why they have tantrums. That's why they throw fits. That's why they don't obey, because they're just so full of life and they just want to experience every bit of it. And that's why they can go unwind so much easier than we can, because they're not exactly in tune with themselves, but they are, in the fact that like they don't care what happens. They don't care as much as we do. Like we're afraid, like, oh, someone's pulling on me, I don't know about that. They're like, okay, they might be distracted, they might resist you a little bit, but once you calm them down and get to that, it's like a minute.
Can you share real quick how you had that experience with son Julian?
Yeah, no, but with my 2-year-old, like I noticed when he walked, like both of his feet would kind of turn inwards, which can indicate that his hips are starting to rotate anteriorly into his body. And what was really cool, the first time I treated him, I gave him like a phone so he could watch something while I was treating him. But it was still amazing. Like within 5 minutes, had released both of his legs, released his hips, and he had the most energy. And this was at the end of the day. Like he was tired. We were winding down for bed, and he was running, laughing, leaping like he normally does. But it was just like you could tell this was extra. This was more. This was like something just happened. And the second time, I tried to not let him have the phone, just try to do it with just him and me. And at first, he's resisting a little bit, so you kind of just give into it, play with him a little bit. But then I was able to distract him. I wanted to work on his right leg, so I kept, pumping like his left leg because he just wanted to kick. But then I held traction and kept kicking here, and then within 30 seconds, I felt my hand moved back. Obviously, not too much tension, but it moved back. His leg released, and he was walking normally again.
Wow,
it's amazing. And that with an adult. I'm not saying this is with everybody, but like that could take an hour, an hour and a half of working all over their body, because there's so many other restrictions that have built up over the years. But he's only 2. He's new to this world, and so is, my little sister. She's 4. Like they're just so ready, and that's what we can learn from children. Be more, have the childlike faith, just believe in that, believe in everything around you, and how it can help you, affect you, and try new things.
Yeah.
Amazing.
I love it.
Yeah.
I love it. Well, I think we've kind of talked about this one pretty good.
Yeah.
I'd love, if you like this, we're going to go into MFR. We're going to talk about Pilates. We'll talk about gyrotonic. We're going to talk about yoga, like movement, and really tease out what is the beauty of these practices and what to look out for as well. Like we want to really use this as an opportunity to continue to educate about movement. Please like and subscribe, follow us as well, and just see what we'll put some other things out as well to keep having you think about your fascia. Or your fascia is something just as much you want to tend to, just as much as eating, breathing, sleeping. Tend to your tissues.
Yes.
I like that. Tend to your tissues.
Yeah. But yeah, we want to help you show that like the body has a way of healing, and it has a way of fully healing itself with just a little bit of help. And yeah, like you said, we want to talk about that, warn you about certain things that we don't personally agree with, and that can be your decision. It's your decision ultimately. But just know that like this is what true healing is, because the fascia connects to everything. So how could not working on one part help the another part, and so on and so forth. But yeah.
All right.
That was good. Thanks for joining us. Look out for the next podcast. We'll be coming soon. But yeah, like you said, like and subscribe.
All right. Take care. Have a good one.